Hello doctors, my name is Ilya, and this is a new medical cycle here on the internet. Let's face it, English is crucial today, especially for a doctor, when all the most important medical researches and studies are published in English and only translated into Russian a few years later. So what we are going to do here is speak medical English. In the first part of every episode, we will learn and discuss 10 new words and phrases in English. Right after that, there will be a listening. What did the professor say? Then we will discuss some English grammar, and at the end we will translate some common phrases from Russian into English. So, what is the worst case scenario if you're a cardiologist? Obviously, it's a heart attack. In other words, it's a condition when an artery that supplies your heart with blood and oxygen becomes completely blocked by a clot. The interrupted blood flow can damage or even destroy a part of the heart muscle. A heart attack, also called a myocardial infarction, can be fatal, but luckily the treatment has dramatically improved over the last few years. Now I'm going to repeat the new 10 words and phrases for you. Stay tuned. The worst case scenario. The worst case scenario means the worst possible outcome. To supply. To supply means to make something wanted or needed available to someone. A heart attack. A heart attack means a permanent damage to a heart muscle. It is also called a myocardial infarction. A clot. A clot means a thick mass of coagulated liquid. To interrupt. To interrupt means to stop a continuous progress. To treat. To treat means to give medical attention or care. The synonyms for this word are to heal or to cure. To improve. To improve means to make something or become better. Now, let's practice in listening, ladies and gentlemen. Watch the following video and try to catch the professor's words.
So certainly patients who develop heart failure after MI have a very poor prognosis compared to those that don't develop heart failure. And what we're really talking about is left ventricular systolic dysfunction in the context of myocardial infarction.
So, what did the professor say? Suddenly, patients who develop heart failure after a myocardial infarction have a very poor prognosis compared to those that don't develop a heart failure. And what we are really talking about here is left ventricular systolic dysfunction in the context of a myocardial infarction. Better now? Let's watch it with the subtitles.
So certainly patients who develop heart failure after MI have a very poor prognosis compared to those that don't develop heart failure. And what we're really talking about is left ventricular systolic dysfunction in the context of myocardial infarction.
Now, let's discuss a couple of interesting phrases from this little video. A developer, to develop. When we hear these words, we subconsciously imagine some IT guy who is creating some software, but actually these words mean something else. When something develops, it grows. But when you develop something, you create it. Your myocardial infarction may develop into a heart failure, and you may just develop a medication to prevent it. So the phrase, patients who develop heart failure after a myocardial infarction, means that we're speaking about the patients who had a myocardial infarction that turned into a heart failure. A very poor prognosis. A very poor prognosis means that there is a huge chance that everything will go completely wrong. Everything will be like in the worst case scenario. Grammar. And now let's repeat one of the easiest tenses in English, present simple. We use present simple to speak about repeated actions, habits, hobbies, and also general truth. Now let's have a look at this little table to recall the main aspects of present simple. In affirmative sentences, we use the S ending for he, she, and it. For example, I treat my headache with hot tea, or he treats his headache with aspirin. In negative sentences, we use doesn't for he, she, and it. In all the other cases, we use don't. For example, nurses don't interrupt surgeons, or a surgeon doesn't interrupt nurses. We start questions with do or does, again depending on the pronoun. For example, do we improve the quality of healthcare? Or Does she study English hard enough to be a professional? Когда пациент заходит к вам в кабинет, какой первый вопрос вы зададите ему? Что случилось? Где болит? Как вы спросите это на английском? What's the matter? Where is the pain? Снимите, пожалуйста, рубашку, я вас послушаю. Please take off your shirt. I will auscultate you. You can also use the verb to sound in informal speech because it is a synonym. Сделайте глубокий вдох, выдох. Please take a deep breath. Now breathe out slowly. Мы используем слово breath как существительное и слово to breathe как глагол. Меня смутили результаты ваших анализов. Вам стоит снять ЭКГ и сделать УЗИ. I'm not really satisfied with the results of your medical tests. You should take an ECG and make an ultrasound. Ваш пациент жалуется на боль в груди, тяжесть и чувство жжения. I'm having a chest pain and pressure, and it feels like it's burning. That's all for today, guys. Thank you for watching. I really hope that you learned something new today. I'm attaching the rules and some exercises under this video as a PDF file, and I do recommend you to study with your friend or a colleague. It will be much more effective. Bye! By the way, let's imagine that you're at some conference and nobody around you speaks Russian. So what is the most important question you should know how to ask in English? Excuse me, where is the coffee machine?